Good afternoon. My name is Francis Cummins. I work as a family practice physician. I also have a subspecialty in hyperbaric medicine. I'm sure many of you are aware of the picture that you have on your screen. That is the Ebola virus. And I've been watching the events unfold in West Africa with considerable interest. I'm not a virologist. I don't have a PhD in infectious disease, but I think I have found some information that, I find at a minimum very interesting. Very, very interesting, and it is somewhat out of the norm, at least in terms of the discourse that you find on the major media. There may be a potential Ebola therapy, which I found uh, going through some government documents. Actually, these are published peer-reviewed journals where I found some information that kind of directly relates to the Ebola therapy, correction, to a potential Ebola therapy. Now, this is a very short YouTube video. This is my second attempt. This is the first time putting words to it, so just so bear with me. So, this information that I am getting ready to reveal to you, or will be up in the next couple of slides right here, I would like you to know that I have sent this information to the following organization is listed right here on the screen. Those include the White House, the CDC, National Institutes of Health, Doctors Without Borders, and several well-known websites. I have not received any response back from any of these groups regarding this therapy, potential therapy, or an adjunct therapy, except for the White House, which basically said thank you very much. So this I found a few months ago. This was actually published in December of last year. That's 2013. Probably about the time some people think that maybe this current Ebola outbreak started to rear its head. I don't want to read the whole thing, and you can actually pause the video and read it for yourself. But I want to just read a portion of it. We'll start off from where it says, like, however, the effect of heme oxygenase 1 activation on the Ebola virus replication remains unknown. Now, to determine whether the upregulation of the heme oxygenase 1 attenuates the Ebola virus replication, we treated cells with a cobalt protoforin. This is a selective heme oxygenase 1 inducer, and assessed its effects on the Ebola replication. And I will skip ahead a few lines. Actually, so we found that the COP treatment and pre and post infection significantly suppressed Ebola virus replication in a manner dependent on the heme oxygenase 1 upregulation and activity. So the way I read that is that the heme oxygenase 1, when you increased it in its activity, that actually suppress the Ebola virus replication. And it says, in addition, stable overexpression of the heme oxygenase 1 significantly attenuated the Ebola virus growth. Although the exact mechanism behind the antiviral properties of the heme oxygenase 1 remain to be elucidated or found out or discovered, their data shows that this upregulation does not attenuate the Ebola virus entry or budding, but specifically targets the Ebola virus transcription and replication. Therefore, modulation of the cellular enzyme heme oxygenase 1 may represent, here they say, a novel therapeutic strategy against the Ebola virus infection. And if we listen to the media, all we hear is potential that ZMapp drug, which so far hasn't had the we call stellar results. And I'm not saying that maybe this heme oxygenase 1 would have stellar results. And then there's potential hope of vaccines maybe coming down the pipeline, which may have some benefits. And we're not going to even get into the vaccine issue at this point right now, because I think that is something that probably needs to be discussed at a later time. And there are a lot of people already looking at that. The key point here is that December of last year, that's 2013, these people in this peer-reviewed journal show that heme oxygenase 1 significantly attenuated Ebola virus growth and significantly targeted the transcription and replication of this virus. And I think that is it's kind of earth-shaking, because I haven't heard anything about this. And mind you, I sent this document to all the people that I have listed in the previous slide. So let's go on to the next slide right here. And so I have a background in hyperbaric medicine, and so I know in my research and my training that I had seen an effect of the heme oxygenase 1 in the hyperbaric medicine, but I wanted to get the exact proof or documentation of that. So I got that. I'm not super computer savvy, and so I only copied a portion of the abstract right here. But let me read part of it to you. This abstract came from the peer-reviewed journal called Carcinogenesis, volume 21, pages 1795 to 1799 in 2000, so roughly 14 years ago. But as you can see plainly right here, it says, we now demonstrate increased levels of heme oxygenase 1 in the lymphocytes 24 hours after HBO treatment of volunteers. So these were people, these were not subjects, say like monkeys or dogs. I mean, these were people. Under the same conditions, the superoxide dismutase catalase and the DNA repair enzymes, apernuric and endonuclease and DNA polymerase beta were not enhanced in expression. It said, we'll skip ahead a few lines. It says, our results suggest that increased sequestration of iron as a consequence of induced heme oxygenase 1 might be involved in the adaptive protection of HBO treatment, and that the induction of DNA damage is not the trigger for adaptive protection. So the way that I read that is that when these volunteers went into this hyperbaric chamber, they actually had an upregulation or an increase in their heme oxygenase 1. It looks like there may be initially a DNA damage after the first or second or hit, but then the body developed not antibodies, but antioxidant systems, and the body adapted. The key point here is that all they did was put these people into a chamber and it increased their heme oxygenase 1. And if you recall from the previous slide, from the research that came out in December of last year, the heme oxygenase 1 uh, appeared to significantly reduce the transcription and the replication of the Ebola virus. When I read that and I put those two pieces together, I'm like, well, I'm not saying this is a therapy, but this might be a way to give the victims or anybody who's infected with this virus more time and maybe a chance for their body to develop some type of immune response. Uh, you know, I just think that is kind of earth-shattering. Like I said, I'm not an infectious disease person. I am not a virologist. I haven't spent years studying, the ins and outs of these mechanisms of viruses or any type of infectious disease. What I've learned in medical school and afterwards, but this right here appears to address something that is happening in the world right now, and all I've heard, I think all many of us heard from mainstream media, is that there's nothing we can do. We'll put them in camps, and we'll try to hydrate them, keep the fluids, and maybe 30–40% of them will survive, and there is no therapy. I hear calls for looking or thinking outside the box. I would consider this maybe sort of thinking outside the box and maybe inside a hyperbaric chamber. So what is also kind of interesting is that here in the United States, there are approximately 14 indications for hyperbaric oxygen therapy. Anything outside of those 14 is considered off-label, and insurance will not pay for it. However, one of the indications for hyperbaric oxygen therapy is severe anemia. By the definition here, I got this off the UHMS website. It's the Understanding Hyperbaric Medicine website. It says patients who have a marked loss of red blood cells mass by hemorrhage, hemolysis, or aplasia run the risk of lacking adequate oxygen carrying capacity by blood. The more quickly the severe anemia develops, the less tolerant the patient may be of the insult. So severe anemia is actually an approved indication here in the United States. I've heard many people say this is a therapy looking for a disease, and it is not a therapy looking for a disease. This has a determined to be an indication of its use. That is severe anemia. So what do we have going on here? So say this right here is I found this approximately 3 weeks ago. I have not been able to find the actual text of the article, but this research was actually based out of the old Soviet Union prior to the collapse of the Soviet Union. And the title of this article is, as it sees right here, is the effect of hyperbaric oxygen on erythropoiesis in the recovery period after a hemorrhagic collapse. And I thought that was somewhat interesting that they were looking at, how do you use hyperbaric oxygen in a person who's had this collapse, i.e., probably, they might have anemia, potentially severe anemia. And the abstract was actually somewhat favorable. It was favorable. Rather than me put that information right up here, I said, I request that you just Google the above and read that abstract, and then you make up your own mind uh, as to whether you think that this is a potential therapy or not. If you do, then I would raise the flag, and if you knew anybody, pass it around, because I guarantee you that the hospitals that have hyperbaric chambers uh, do not know of this, and would not treat anybody for Ebola in it. And that has to do with a whole lot of different things, and who's covering it, and the specialties, infectious disease and security, and that's a whole another gamut. All my quest right here was, this looks very interesting just on the surface. Uh, Now, what I don't have listed in these slides, and I just want to put this out here because uh, I have found a lot of information that was around the subject of viruses, not particularly Ebola specific, but in terms of viruses and vaccines. And I found in food research articles, it appears, at least over the last 10 years, um, the food industry was looking at ways to inactivate bacteria as well as viruses. And believe it or not, and these again is in peer-reviewed journals, so you can just go to PubMed and you can start Googling, actually put in your search criteria in there, and you will find in several food research articles um, um, techniques that people have come up with to neutralize bacteria as well as viruses, and those techniques actually happen to be pressure, not oxygen, just like, guess it's just pressurized air. Now, I was reading these journals, and the pressures that they were subjecting these viruses and bacteria to were significantly higher than what humans could stand. Uh, but the point is that pressure seemed to inactivate the virus. In their research, it said that the viruses appeared to be inactivated. However, the viruses still allowed the organism to develop immunogenic response. So the virus was not infective, but the organism, it appeared, could recognize it and then develop an antibody response. And why is that significant? Because in some of these related journals, one of the ways they inactivate vaccines is, yep, you guessed it, pressure. So they didn't say particularly what vaccines, but vaccines can be inactivated so they can retain their immunogenicity by using pressure. And that actually, when I read that, that actually gave some credence to the the heme oxygenase 1, which those patients were under some type of pressure, hyperbaric oxygen pressure, and some credence to the heme oxygenase 1 article. But what it actually gave some more credence to was not here, but I would ask that you look up a gentleman called Dr. Cunningham. And during the Spanish, this is well known in the history of hyperbarics. And I'm not saying hyperbaric oxygen, I said hyperbaric. This is going back to 1918 when they had the pandemic or the Spanish flu. This was a gentleman here in the States who had a hyperbaric chamber, and as I was told and what I've read is that he noticed that people who contracted the influenza virus or the Spanish flu who lived at higher altitudes appeared to have a worse outcomes. So he theorized that, hey, what we'll do is we'll bring them down to a lower altitude, we'll give them pressure, and maybe they will do better. And um, from what I've read, he supposedly had, a lot of good outcomes by just pressurizing people in a hyperbaric chamber. He wasn't using oxygen, as I understand it. He was just pressurizing them in air. Um, I was told in my training there was a lab tech or a medical student who was almost yanked from death's door when he was put in the chamber. Um, but I haven't been able to find that in the literature out there, but it might be. So I'm not discounting it. However, he did kind of have a bad outcome at one time when there was actually a mechanical failure while he was pressurizing a group of people, and there was a mechanical failure. I'm unsure as to what the mechanical failure was, and the those people died in the chamber. Uh, but that was a mechanical failure. That was, a long, long time ago. Um, but that the fact that he was able to, treat a lot of people just by increasing the pressure gives a lot of credence to some of the food research that talked about inactivating viruses just by adding pressure, or even vaccines, making them the virus portions are making them inactive portions of it just by subjecting it to pressure. So I've said my piece, so I would encourage you just to look at this, look up the information that I have out there, or that is out there. It's not necessarily what I have.